Boa tarde. This is a Portuguese speaking country's session. I saw some hands complaining that no. It's true. Good afternoon, everyone, and thank you for coming for this session. Very innovative and particular session, which brings together investigators, partners, friends of Lusophone countries. For those who probably are not aware, in Africa, a part of a large number of Anglophone countries, Francophone countries, we have a few countries who speak Portuguese. So they have particularities, familiarities, which make them a small family. So with your permission, Sua Alteza Real Infanta Cristina, I don't want to say this in English because I've never done it before. So I prefer to make sure that I'm correct. So invited colleagues, whole protocol observed. This session will be having some particularity because we are going to project a video. The video is related to the talk from the Gulbenkian Foundation administrator, which is Martin Esse, and then we follow with a talk from Infanta Cristina, and then we'll be inviting other colleagues from different countries to give their point of view and where they are in terms of progress and challenges and research. So if you allow me, the Portuguese-speaking countries in Africa, they're dispersed. So you'll find them in the west side of the continent, Angola in the middle, Mozambique in the south. And each of us, we have a very specific characteristics. If you go to Cabo Verde, probably we'll find a completely different environment. If you come to Mozambique, okay, I'll show you when you come. And if you go to Guinea-Bissau as well. So at the end of the day, because of the language, of the history, we are family. We are family for anyone. Informally, and this has been a discussion within EDCTP, because, a very interesting discussion, I remember it very well during the General Assembly. We reached a point where colleagues were asking if some calls has to come in French or in Portuguese because of the differences on capacity for the applicant to write proposals in English. And some of them, they're very clever investigators. But because of the language barrier, they will not be really compete in the same level of other colleagues. Unfortunately, when you look at the graphs that most of the time EDCP used to share, and looking at the trends of groups who get funded by chance, Lusophone countries are not on the top because for many other factors, not because of the language probably. But the same discussion applies for Francophone countries and colleagues. Also, they were saying, I remember very well Francine and Tommy saying that probably we should be allowed at least to submit proposals in French. Because if you do that, probably we can be in a better position to demonstrate what we can be able to do. But the science, the language of science currently is English. And we, as investigators and family in research, we need to come together with our differences, probably imbalances, but we recognize that at least for official communication and make our life easier, we should probably being used in English. That's why even when Gulbenkian launched calls to get in partnership with the La Caixa Foundation, in some way it became English as an official language for communicating in science. So, but also we recognize that probably there should be an extra effort. This year, we were working in a project funded by EDCTP called Pan-Africa, we present this morning. And within the project, we created a scholarship for masters and PhDs. So that scholarship allows colleagues who have difficulties in communicating in English to allow them to go and prepare themselves to be able to go through the PhD program. It means that it's a real problem and real difficulties. We cannot ignore it. Today is Portuguese, but you can say this for Anglophone colleagues and not Anglophone, Francophone colleagues who are facing same challenges. Before I proceed with my talk, allow me to pass a video from Gulbenkian Foundation administrator. They told me just press the button, so I'll do that. It works? No. Again? Okay. In Africa, when it doesn't work, you have to pump it a little bit. And is it? This one. Okay. It will work. Somos nós ou são eles?
Acho que são eles.
I am very sorry not to be with you in person for what looks like a fascinating and intense program. But I am glad that my colleagues Maria Aminha Cabral and Sandra Ferreira are with you, as well as our close partners from La Caixa. The promotion of health research in the PALOP countries has been a long-standing priority of the Carlos Gulbenkian Foundation. And we continue to believe that although these countries face many challenges, there are also many opportunities and some very good researchers. We commissioned a study in 2021 to study health sciences research and its funding in the PALOPs, and found that although scientific output has grown steeply in the last 12 years, it has lost global share. And more concerning, less than 25% of research is led by researchers from the PALOPs. We are committed to working to raise this proportion by investing in training and fostering opportunities for young researchers. We will do this, as we always have over the last 15 years, in partnership with others, because this makes us all more effective. We learn so much from our partners, and the sometimes difficult debates inevitably improve the result. We are particularly proud of the work we have done with EDCTP, following on from our joint MOU in 2014 and hosting the 9th Biannual Forum in Lisbon in 2018. And of course, we're proud of our partnership with La Caixa Foundation on clinical research and enabling research centers and hospitals to operate together closely. I hope you continue to have a highly successful meeting, and I look forward to hearing the takeaways from my colleagues.
So thank you. Following this talk, allow me to invite Infanta Cristina, on behalf of the La Caixa Foundation, to give you a speech, please.
Thank you. Thank you, Silvio. Good afternoon. Boa tarde. It is a great pleasure for me to take part in this session, Meet the Researchers of PALOP, among so many friends and friendly faces. I would like to thank also the EDCTP Organizing Committee for facilitating the Calouste Gulbenkian Foundation and La Caixa Foundation to organize this session. Eusebio Macete for accepting to be moderator of this particular session, as you named it, and the senior researchers who will generously share their experience and knowledge with the audience. But very briefly, for those of you who don't know about La Caixa Foundation, let me just give you a small introduction. It was set up almost 120 years ago with the aim of contributing to people's progress and building a better society for all. Currently, it promotes social, cultural, and scientific projects, supports scientific innovation and quality education, and fosters talent so that we can all improve individually, but above all as a society. The foundation is very active in promoting research projects in Spain and Portugal, with a major impact on health challenges, and also supports universities, research centers, and hospitals. Most of the foundation's programs are carried out in Spain and Portugal, but since 1997, we have also been working on international cooperation programs focused mainly on promoting global health through projects that combat the main diseases that affect poverty, job creation, training and education, and humanitarian and emergency aid. The program is committed to generating opportunities and combating inequalities for the most vulnerable populations in countries in Africa, Asia, and Latin America, always in line with the Sustainable Development Goals and the 2030 Agenda. Since its inception, the foundation has supported many programs in Africa in the area of health, with focus on the fight against malaria, pneumonia, and malnutrition, and also by training researchers, health professionals, and/or managers of research institutes. We always implement these programs in partnership with some of the main international organizations, such as the UNHCR, UNICEF, the Bill and Melinda Gates Foundation, of course the Calouste Gulbenkian Foundation, the Aga Khan Foundation, Gavi, the Vaccine Alliance, and also with African governments on research centers. The partnership of La Caixa Foundation and the Calouste Gulbenkian Foundation goes a long way back. And so does our joint commitment to supporting scientific research and scientific institutions in the Portuguese-speaking African countries, the PALOP. Since 2015, both foundations have co-organized and given support to 3 editions of a course in science management together with the Centro de Investigação em Saúde da Manisa, Mozambique, and the Barcelona Institute for Global Health is Global. A call for proposals for the researchers who took part in the science management course, 3 projects which resulted from this call and that are currently being implemented in Angola, Cape Verde, and Mozambique, and whose senior researchers are also taking part in this session. And we also organized several seminars and webinars. This year, we launched the call for proposals, research, to encourage scientific communities to carry out research projects that contribute to improving healthcare and strengthen scientific institutions in the PALOP countries. And today, we are extremely pleased to have within us 5 women that will be conducting research projects in the areas of cancer, malaria, respiratory diseases, and genetics over the next 3 years in Angola, Cape Verde, and Mozambique. 5 projects were selected out of 75 applications received, which just shows great interest in carrying out research in improving knowledge about the diagnosis and treatment of the main diseases that affect their countries. The support of researchers from PALOP to attend the 11th EDCTP Forum, the organization of this session, all of this is part of our joint commitment to empowering researchers, particularly young people and women. And I must say we're very happy to have them between us. I think it's a very special moment to be able to listen to them directly this evening. As you have seen, the partnership with the Gulbenkian Foundation is, in our view, a very good example of how, by joining efforts, we're able to do more and reach further. For this reason, I would like to stress the value of partnerships, all partnerships, not only partnerships between African centers and European or American centers, but also those that can be created between African ones. This, I guess, could be, let's say, our dream, our ultimate goal, that scientific institutions and researchers from PALOP can cooperate between themselves and other African countries and become important players in the global health field worldwide. The challenges, as you know well, are huge, and it will be quite naive to think that we will be able to solve them successfully on our own. We need to sum up private sector, scientific institutions, academia, governments to work together so that we can make a significant contribution to advancing research and the fight against the major global diseases. Rest assured that we will remain true to our commitment, promoting global health and forging alliances in line with the Caixa Foundation's motto, that is, it is only progress if we all make progress. Thank you very much. Muito obrigada. And back to you, Eusebio. Thank you.
Thank you very much. After those talks, just open this session, we have very good representation of gender balance in this session. I take this for the previous session, for those who were there, were almost crying this afternoon. So we'll have opportunity to listen to our colleague, Nilza de Deus, from Mozambique. Just coincidence. So she works at National Institute of Health. She's the chair of the Institutional Ethical Committee. She works mostly in virus, in new vaccines, but also recently she get funded by Carlos Gulbenkian and La Caixa Foundation in a new project on COVID. So Nilza, please, the floor is yours.
Good evening. That button that you had to click disappeared here. Okay, now yes. Thank you. When you came here, it came also. So, good evening. It's a pleasure to me to be here to talk not only about the project that I have funded by La Caixa and Carlos Gulbenkian Foundation, but also I would like to talk a little bit about the institution, INS, National Institute of Health, and share with you a little bit what INS is doing. It's not possible to tell everything, but I selected some of the projects. So for those who don't know INS was established in the 50s and went through different structurations. In the 70s, after the independence, was incorporated to the Ministry of Health, and then in the 90s was designated as a semi-autonomous institution. And then in 2004 was had the organic statute approved, and recently it was redefined, and now INS is a new institution, has tutored by the Ministry of Health, and has a new organic statute published in 2018. and the internal regulation approved in 2019. This redefinition of INS has a reference, the Public Health National Institute, which you can see here, but has a public health institution. It has a major importance because it's a science-based institution which provides leadership and expertise to the national level to achieve mostly long-term improvements in the public health, and also has a National Public Health Institute or organization is multifaceted, which means that staff from INS had a wide range of skills, and it allows to improve the public health and to influence health policies in Mozambique. This is the inaugurations. I brought some pictures from those who don't know INS. We have inaugurated a new building in 2019, which is the headquarters from INS. Before, we were working at the building from the Minister of Health. This was a very important achievement from our institution when we put together with this redefinition that I mentioned to you before. So INS works with 4 major pillars, I would say. First is research in health and welfare, promoting and developing research in health in Mozambique, elaborate policies, proposals, and evaluate health strategies, and conduct a very wide research on biomedical, pharmacological, epidemiology, operational research, and also socio-anthropological. Also, we have one direction which is from inquiries and health observation, which contributes to the prevention and control of endemic, and they were very busy on the COVID pandemic. Also, this pillar conducts health observation to document the health of the population and submit proposal to improve the health. We have public health laboratories which carry out quality control of laboratory to ensure that the quality of the laboratories at national level can be with the same quality. We have training and communication health, where we contribute to the development of women resources in technical and professional scientific area, and also we disseminate these data also with public community and policy makers. I put down one thing which is important and can touch the 4 pillars, which is the partnership with national and international institutions to carry out research, training, and public health activities. INS is present in 9 of the 11 provinces in Mozambique, except in Manica and in Nyasa. I don't know if you can see here, but in the north, we are not present yet, and in the center, in Manica, we're not present. But in almost provinces, we have all delegations or a public health laboratory, which improves our presence in the provinces, but also we can also do research, surveillance, and also processing samples in the provinces. So now I'm going to share a little bit about the research that INS is doing. I borrowed this slide from my colleague Celso Cosa. If you want to, after talking with him, he's here. So I don't understand a little about TB, but I'll try to tell what he's doing on TB. So Celso is the leading person on TB. I understood that, for example, the erase TB has the objective to detect and prevent and erase the TB in the country. Celso is saying yes, shaking the head, which is good. I understood. Thank you, Celso. So those projects are funded mostly by EDCTP. Also, they have projects on called TB Speed, which has the objective to detect TB in children, because they think that they are neglected on the TB, and there is an important challenge to detect TB in this population. And also, they have a project called TB Sequel, which has the main objective to understand what are the main sequels of the TB, not only has a clinical, but also economic impact of the TB in the population. And they have also included policymakers in this project so that at the end they can contribute to improve the management of the patients with TB. I'm going to now talk a little bit about the project which is funded by La Caixa and Gulbenkian Foundation. So we received a fund to make a research in children, because when COVID pandemic started in Mozambique, we had a lot of work done in adults, but we did not have information on children. So we proposed to do a study in the rural, peri-urban and urban area to understand what was the impact of the COVID in children. So what we figure out is that we understood that almost 80% of the children had contact with SARS-CoV-2, which was the majority of the population. And when we compare with data with Manisa Health Research Center, where almost similar, and also we saw that this prevalence increased with the time, because Manisa previously, in 1 year before, reported less than that in children, also in adults. We also wanted to see the burden of the COVID in hospitalized children. So we went to see children that were hospitalized with suspicious of having COVID, and they diagnosed it as COVID positive. So we found that 30% of those children died with COVID. And then we took this population and we analyzed it to understand the comorbidities and which characteristics would be associated to those children. So the most interesting data that we bring here was the respiratory distress that we already know, but what took our attention was the low weight for age, where 61% of the children were, we could say, undernourished. And this data was important for us because in other studies, we were seeing that children hospitalized and either for diarrhea or respiratory infections, the malnutrition is playing an important role in our country. And also the TB speed that I mentioned before, one of the targets is also to make the diagnosis of TB in undernourished children. So this it's important for us. The data I'm presenting here, we haven't published it yet. The first data we have submitted for publication, but this one we are finalizing. I'm going also to share a little bit what we have done on rotavirus. It was a study that was co-funded a time before by Gulbenkian, thank you, where we assessed the cost effectiveness of rotavirus in Mozambique, and we saw that was 35%. And also we found that stunted was playing an important role because the vaccine effectiveness was lower in those children. I'm going to jump this because it's a study where we compare 1 drop versus 2 drops from the vaccine to be used in polio campaigns. Has an example of a study which influenced the policy, public policy, because SAGE recommended use of 1 drop in emergency situation worldwide. So I would like to thank you for the attention, to the foundations for the facilitating this and allowing us to do the research, also for giving me this scholarship to be here and present this to you. Please come to Mozambique, as Dr. Masset says. One of the places he wants to show to you is this one, is Ilha de Moçambique in the north of the country. Thank you.
Thank you, Nilsa. I was suffering because I tried to give a sign for her to stop, but she was intentionally looking at the other side. So thank you, Nilsa. So allow me to invite Dr. Neide Rodrigues. Neide was trained in Lisbon. She got her PhD on cancer, immune oncology. Now she was also funded by La Caixa and Gulbenkian Foundation, a project called Incubator. So Neide, welcome and thank you for having your time with us. Okay, it's fine.
Okay. It's fine. Okay. Good afternoon. Firstly, I want to thank you to La Caixa Foundation and the Calouste Gulbenkian Foundation for this opportunity. And after I started to speak, I want to present my incubator team. Cancer research about the incidence and prevalence in Africa is crucial for national government, cancer prevention support, understand cancer biology, and adapting cancer diagnosis and therapy in PALOP countries. In this context, high incidence and advanced stage at diagnosis is a common feature of the prostate cancer in both PALOP countries, Mozambique and Cape Verde, contributing to poorly survival rates. As you can see, this scenario is very complicated. Why? Because we not have the cancer center researcher. We have a lack in the supporting. We have a lack. I don't know. It's fine. Okay. Sorry. We have a lack in the management support. We have a gap in the basic and the clinical research. That's the reason we created the incubator project. The incubator project is project to implement the physical and the virtual laboratory. This laboratory is laboratory of the histopathology. Histopathology is very important to diagnose cancer and subtype of the cancer. This kind of the laboratory to allow to identify the subtype and to choosing the specifically drugs for treating. And as you can see, we have important results. And as you can see, we are implemented the laboratory histopathology at the University of Cabo Verde. We did the training for a medical community. We have a lot to collaborate with the medical community. And this project is very ambitious and unique. Unique because we focus in human resource, because we need to increase the capacity of the immune resource in Africa. It's very important for us. And for future, we want to contribute to reduce exposure to modifiable cancer risk, discuss with the other team in the PALOP about cancer risk factor, including age, family story of breast cancer, and for us it's very important to have a platform in Portuguese, because we have the barrier of language. And we have lost lot date that very important for healthy public. Date have this rate very important for study, for creating a community research, for look for research for capacity the building. I'm sorry. Okay. And in conclusion, I want to say La Caixa Foundation and the Galusti Gulbenkian to continue to help us, because we have a lot gap, we have a lot lack. We need to increase human resource capacity. We need reinforce laboratory of histopathology. We need family in the science, because in Africa we have pressure, social pressure, to maintain balance and family work and social work. This is the reason it's very important to invest in human scientific Africa, because the human is the way to have education, of quality education for all. Thank you.
I think today I'm really involved in the gender topics, and just to, if Nadia allow me, Nadia has just had a baby 2 months ago. So, so for her to be here with us is a real double effort. So thank you, Nadia, for making that effort, and we really appreciate it. So then we'll move to Baltazar de Sá. Are you ready?
Yeah, I'm ready. I was born ready.
Okay. Okay. So please introduce yourself. So come. We have to gain time.
Okay. So thank you very much. It's really a great pleasure to be here. I didn't give Zebu time to introduce me, so I'm going to introduce myself. My name is Baltazar Ka. I am from Guinea-Bissau. I hold a PhD in molecular cell biology. Sorry. I hold a PhD in cell and molecular biology from Portuguese University, where I've been working until 2020. Basically, when I finished my PhD, I went back home, and now I'm working in Banding Health Project and in NASA, that is National Institute of Public Health in Bissau. Before I start, I have to mention that among them, I'm the only one who has not yet hold a La Caixa and Gulbenkian Foundation grant, but I'm still running. I will apply, so I will get it. I will get it sooner or later. I will get it. And by the way, I am also the only male apparently, so we have to shift things. So, having said that, let me present what I did. Oops, sorry. But yeah. When I was, sorry, what it is? Yeah. When I was invited for this talk, the idea was to talk about the opportunities in our countries. And somehow, what I will present is what have been done in the country for several years now. We have these two institutes in NASA, that is National Institute of Public Health, and Banding Health Project. Formally, Banding Health Project is under NASA, so I will mainly focus my talk in Banding Health Project, but we assume that I'm somehow referring also to the Banding Health Project. I am fortunate enough to have two great women in this room, our former Minister of Public Health, Magda, and Christine, that are leading us for many years now. So, what I'm going to when I was starting to think in this presentation, so the one thing that came out of my mind is a recent work that Gulbenkian Foundation commanded, and it was mentioned in the head of Gulbenkian Foundation presentation, the 2-minute presentation we had. Basically, this map is a study who mapped the production in a African Portuguese-speaking country. So in this, there is a figure that shows that apart from Mozambique, that is far away from others, we have Guinea-Bissau. We have Guinea-Bissau, who, although the size of the country and the resources, we have the third in this rank. But I think, I'm quite sure, if we translate this in terms of per capita production, Guinea-Bissau will be maybe the top one. But how a small country without no resources manage to have this huge production in terms of science? I'm telling this to tell you, you should collaborate with us. You should come and see. We have platforms to receive you. Basically, this work is led for many years ago by Banding Health Project. Banding Health Project is now, when we say project, we are thinking on a life cycle of project, but Banding is a national institution now. So Banding Health Project is a demographic and surveillance system site that are in Guinea-Bissau before I was even born. So in 1968. So you have this study area in Bissau and some satellite area that we are studying in urban area all over Guinea-Bissau. So these institutes are being supported for this long year, first by state institute, generally by Danish government, and they are still with us until today. And recently, and when I refer those two great women in the room, they are the ones who signed the agreement of the new agreement with SDU, that is University of Southern Denmark. So basically, Banding Health Project as a huge platform of research, namely what we are really known for is research on measles epidemiology, routine vaccination, HIV 1 and 2 in different aspects, namely in terms of epidemiology, prevention, and treatment. Okay, and tuberculosis, that is one topic close to my heart that when I will show you my own work, you can realize why I say that. And among others, we have twin studies, malaria, and it's a really all infectious disease are represented in Banding Health Project. Another thing that Banding Health Project is really keen on is training local researchers, but this training also is done at the same time with Danish students that go to Bissau. So we have been in this collaboration for many years, and many good stories have arisen from this. So Guinea-Bissau local scientists have been trained on master, PhD, postdoc, and I'm doing my postdoc in Banding Health Project. So this is just to count, and it's the only place in the country that someone who has been trained abroad can go and plan to do a career in science, which is not easy in our context. So also, it's worth mentioning that Banding Health Project is a huge employer in Bissau, and if we see the small enterprise, maybe is the biggest employer in the country. So he has this long-term standing, to create a confidence with community, and we have been doing this work for more than 40, we will celebrate in 45 years soon in this month. So another thing is the local collaboration. Because Banding Health Project, I've been working with the National Laboratory of Public Health, the National Hospital Simon Mendes, and the local hospital, specialized TB specialized hospital, which is Raul Floro. So Bandingal project, I've been supporting this. But I think maybe one thing that we that are recently joined Bandingal project are proud of is the consistency. When in science you are sure of your work, you have to stand for it. So Bandingal project have been keen in bringing this team in the agenda of research, and have been there to, although against all odds, because the scientific community did not accept this idea of non-specific effect of vaccine, and today is something that is largely accepted, and many other fields in terms of immunology are being arisen through this work led by our senior director, and I'm not seeing him in the room, but I would like to have him here, Peter Harvey. That is someone we look up, and until today, with his age, he still go to the Bandingal project every day, and somehow we are learning from him. So this is somehow why everyone is in this room that want to collaborate. We have all this setting, so you can go by there and try to collaborate. And then, this is my own research. What I've been doing throughout my PhD is the study of Mycobacterium tuberculosis complex genetic diversity and its impact in disease presentation and severity. And also, lastly, I've been trying to study the management of latent TB infection, namely in vulnerable population, I mean HIV co-infected people, and diabetes, that type 2 diabetes that are increasing. In earlier presentation, someone was talking of this double burden that are happening right now in Africa, because we always think in infectious diseases, but now these metabolic and cardiovascular diseases are also arising, so we have to pay attention. So this is something I have been working on. And in malaria, this is recent throughout some collaboration we have in operational research. I've been involved also. I've been studying genetic diversity of Plasmodium falciparum, and also involved in some project studying Plasmodium falciparum, studying rich protein 2 deletion. That is very important for diagnosis, because we are using these RTDs. This is something important. And lastly, I'm also involved in training master and PhD students. I'm just a recent postdoc, but I already have this opportunity to involve in some consortium, namely Marcad Plus, someone may know it, and WAMCAD. WAMCAD is a Bill and Melinda Gates funded consortium that we belong to, and somehow is working on improving malaria modeling in these 5 countries around. So what I'm going to show you, I will not have time to go deep in, but as I mentioned, my field is studying of molecular diversity in Mycobacterium tuberculosis complex, because we thought that is a clonal pathogen, and the diversity within the complex was not important for the outcome of disease and severity. But throughout this and other research, we proved that this is not the case. And in Guinea-Bissau, we have this particularity to have, as you can see here, this green lineage 4. Although lineage 4 have been closely, that is Mycobacterium africanum. This is a lineage that are really enclosed in this West African region. So the idea was to understand why and how we can learn from this particular pathogen and try to improve tuberculosis diagnosis and management in the country. So the focus of my work has been this, and I have been fortunate enough to be running this cohort of TB patients in the first study funded by Portuguese, FCT, and Aga Khan network. And we do this study. I'm not going to the detail, as we was told we have only 5 minutes, but just to show you a preview of what we have produced, which somehow I am really proud of. And very soon, we are submitting a paper that in a very high impact journal from this work, that basically we use this healthy MTB infected with Mycobacterium tuberculosis and Mycobacterium africanum somehow to do the first part, that genetics. We saw that lineage 4, that is MTB classic, is more prevalent. And we took blood of these guys to do the blood signature using RNA sequencing, and somehow also to see through in vitro infection. And this part, this more complex part, have been developed in Porto, where I have Margarida Saraiva, my PhD supervisor, that have worked with me for many years, and we're still collaborating. And this just some output of that work. Overall, we have 372 patients enrolled in this study, and we have shown Mycobacterium lineage 6 is still present, although lineage 4 is somehow, because the thing is that lineage 6, Mycobacterium africanum, is less severe, and it's thought that maybe the others are supplanting this Mycobacterium africanum. But we are doing this long-term work in back home. So basically, this is RNA sequences, more advanced studies, and what we see, we clearly show a pattern on lineage 4 versus Mycobacterium africanum differences in terms of gene expression. So what I was lucky in 2021, yes. I was lucky to be among the EDTCP carrier development. So I was awarded a carrier development fellowship to do what we saw in the previous study is that in disease in patient. So we argue that maybe by seeing, and the patient normally, we don't know when they are infected. When they show up in clinics, the presentation is not that different between MTB and MAF infected. So we did what we thought maybe we are going to follow the latently infected person until the point they are developing the active disease. So the idea of all this graph that is a sum up of the EDTC project I'm developing in Bissau is somehow to understand what are the biomarkers of both when we are infected with Mycobacterium africanum or Mycobacterium tuberculosis. So overall, I have some results of this, but the constraint of time I will not show them, but I'm really keen. I will be around if someone wants to delve in that. I will be more than happy to share. So this is the last slide, and this acknowledgement. I have to say, Banding Health Project and INASA somehow have been crucial for this. The funders are important, and it's pity that EDTCP have not anymore this scheme of funding career development, but they will fund the great institution. What that means, countries like ours who public institutes are not that equipped will never have this chance to have guys like me, because the only way for me to stay in Bissau is having this kind of otherwise I'll go to US or wherever I want to go to work. So it's important to La Caixa Foundation and both Gulbenkian Foundation to still think on what. Thank you very much.
Thank you. It was a very clear message for the funders. So we're going to ask our last speaker, Claudia Fransoni from Angola. She's a biologist by training, working in biotechnology, initially in plants, medicinal plants and aromatic plants. Recently graduated, finalizing a PhD at the Universidade de Porto. So very fresh. And please, Claudia, you're welcome. Let me help you with this. Yeah. Is that one?
Yes. Okay. Hello, good evening. Thank you very much for having me here. So I'm Claudia Fransoni from Angola. I started my education in applied biology. As Dr. Massetti said, I recently did my PhD in public health. I am a researcher at the Centro de Investigação em Saúde de Angola, that is part of Instituto Nacional de Investigação em Saúde from the Health Minister. I am interested currently in anti-malarial drug resistance, mainly in vitro and ex vivo, but I've been involved in clinical trials, phase 4. I started my career, professional career, as a lab assistant. I just won my first project as PI, and the name of the project is Probing the Future of Triple Artemisinin-Based Combination Therapy in Angola. What we are trying to investigate, to explore, is the collateral sensitivity that Plasmodium falciparum have in lumefantrine and amodiaquine in order to suggest this combination for a triple artemisinin-based combination therapy. Is a project that is funded by the Carlos Gulbenkian Foundation, and it's being implemented by CISA at the David Bernardino Pediatric Hospital. It didn't start in 2023. It started in February 2022. It is there are 2 types of outputs expected in this project, one scientific and another operational. Scientific is to produce data on the interaction of lumefantrine and amodiaquine and the susceptibility of Plasmodium falciparum to that combination. Then, if the parasite managed to survive that combination, we will look into the possible mechanism used to survive it and maybe discover a new molecular marker of drug resistance. Then we also want to provide data on those responses to other antimalarials being used. And regarding the operational capacity, we aim at create capacity for in vitro and ex vivo susceptibility assays. Because, as far as we know, in Angola, nobody is doing this, and this would increase the visibility of CISA and support clinical trials. So during my the implementation of this project, mainly, I have a lot of difficulties. I've been having difficulties as a researcher, but this, as a PI, I really started to struggle with some questions. The procurement took more time than I was expected, associated with aspects that I didn't count on. And mainly, I will talk to you about the exchange rate fluctuations that happens in Angola, and then can condition the results that you can present to the funders. So this is the variation is an example of exchange rate fluctuation between 2018 and 2023. So the first red line indicates when I submitted the project to funding with a budget based on this currency, and then how it goes through this day. You can see here that the project lost power to buy things, and this conditioned the outputs that I could achieve, that I said that I would achieve. But then good things happen with those difficulties. One of them, I think I am more resilient today than I was before. My institution is more resilient than it was before, not only because of my project, but because there are many of us at CISA, experience same difficulties and the institution is adapting. One example is that I lost the power to buy big equipment, and the institutions has kindly donated a biosafety cabinet level 2 that is expensive, CO2 incubator, and recently a real-time PCR. So that institutional appropriation of the project is continue to be very important. I don't know if my chief, Jocelyn Vasconcelos, is here. I hope she continues doing that. And Joana Moraes also, thank you very much. So I also start to look at the other institutions for equipment that I didn't have, and we end up writing projects about studying the anti-malarial effects of plants, endemic plants. Besides this, I think that I know better my research environment. I begin to know who's involved, the stakeholders, whose the limitations are, what are the limitations, what are the strong points, and this will be important, I guess, for the future projects that I may receive funding. So this research environment is also evolving. It can be seen in Angola that the number of research projects led by Angolan is increasing. Research groups are consolidating. Domestic funding is increasing not only to research projects, but also to advanced training. The number of scientific events is increasing. Scientific productivity, as you saw on the previous presentations, is increasing, and Angola is participating also in north to south and south to south collaboration. I have some images of Fundesit that has received over 200 proposals. Fundesit opened a call for PhD thesis, for research projects, and for institutional reinforcement equipments. Projeto de Desenvolvimento, Ciência e Tecnologia also opened a big call for master degree, PhD, postdocs. Recently, is currently evaluating. I don't think they select anyone right now. This year, we will organize the 8th Conferência Nacional sobre Ciência e Tecnologia. And related to gender balance and to stimulate the participation of women in the research, not only in the research, they created an award, the Woman of Merit Award, that has a specific category for research. I won the prize last year. That was a big incentive because I was struggling so much to put this project on track, that really incentive to continue it. Failing, it's good, I think, if you don't give up. And this is what I bring to you. I don't have results from a project yet. I just read the first essays last month. They didn't go well, but they close a cycle of operational conditioning being created. So the next phase is, let's make this work. Thank you.
Okay, thank you very much, all the speakers. So now this is a forum where we can have a window to see what's going on in those countries. The intention was not primarily to see results. They're good, but also it was a window to interact with the colleagues who are working in those environments. There was different scenarios. from those who are just starting to some of them who are really on track. So they're also inviting us for future collaboration. They encourage the funders to go there and fund them. That was very clear, and especially for Lakasha and Gulbenkian Foundation. So the floor is open for comments, suggestions, and also those two topics that are still behind, gender balance and language barriers. Dr. Magda Robalo, you have been in this environment for a long time. You're still standing here as a woman, so please, I want to hear from you.
Thank you. What a challenge, Eusebio. Good afternoon. Those are big challenges, and you really need to master the language of science if you want to survive, and you need to be resilient. Being a woman, if you're not resilient, you won't survive. So these are what she has just said. You really need to be resilient, and you build your resilience from the challenges you encounter throughout your career. But I must say, I'm so pleased to be here and see so many women, young people, doing so well. Some of you I met before, I've known some of you, and I'm pleased to see you pushing your career forward. And I was just asking, we are missing São Tomé and Príncipe, and we need to pull them. They need to come together. And we need to build a coalition of Portuguese-speaking countries. I see networks being established here and there, and we really need to come together so that we become a more powerful engine as other countries. Small is not a problem. You can be small and be powerful. So we really need to work on our strengths and then see what are the qualities that we can bring to the table. Don't feel like, okay, we are a very small group of countries and therefore we don't count. We count and we are important. We just need to put ourselves out there. The challenge I'm leaving to you is that let's build this coalition of winning Portuguese-speaking countries that we speak French, we speak English, we are actually better than them. Thank you.
Okay, thank you, Wagner. Another question, please.
My name is Dembo Kante. I come from the MRC on one side, and I'm also from something called Waneta.
Okay.
So we have limited money from the EDCTP. I'm surprised I've got the head of finance sitting next to me here. And we try to, because if you look at the gaps and capacity, obviously you could throw in lots of that money into one place, and then probably your results will, you need to be careful as to what results you're going to get. So programs are structured in such a way that we select candidates on the basis of merit. And in that process, and I'm surprised with the quality of the English language that I had from the presenters here. I think Baltazar can probably teach me English. But what tends to happen is that the applications that come from the Portuguese-speaking members in our network is not as good as what you will get from the English-speaking members. And the challenge that we've been struggling with is, what do we do to build English language in the Portuguese partner institutions? And obviously, because of the quality of the English I'm hearing, maybe there are practical things that we are missing that could come out as suggestions from the panel that spoke here, or obviously wider in the room as well.
Okay, thank you. There's Esperanza, please, and then we go to the other two hands in the back.
Good afternoon. Thank you for the presentation. My suggestion for this room is how to Lusophone country can bring the university for the research. If you see for our country, all of our country have university, like Guinea-Bissau, Cabo Verde, Angola, Mozambique. We have university. But what we learn in university is different than we need for the researchers. I think if you bring to university to take more for researchers, we can start early, we can learn more, and we can help more our country. Thank you.
So thank you. No, mine is to congratulate the presenters for what they bring to us. I'm really impressed with what I saw here, and I would like to say that maybe we need to share more on what we are doing, and the numbers will change, because sometimes it's because they don't know what we are doing. And they can't communicate with us because they don't speak Portuguese to ask what we are doing. Then we should communicate and show what we are doing, because there's a lot that we are doing, but it's not in the map, and we can't see it without being here in this session that we had today. I think make us visible, it's our task, not others' task, and depend on us to show what we are doing. And I think there are several forums that we can show our work. We have the Africa CDC conference will be at the end of this month, and I didn't saw a lot of Portuguese-speaking countries presenting there. But I know that their work, we saw here some of this work. And the conference accepts Portuguese abstracts. That means that you can submit it in Portuguese, and then you can have your work also visible in this kind of conference. But mine is to congratulate and ask for more and more visibility on what we are doing.
Thank you, Sunasa. We have one hand there and two after that.
Yeah, thank you very much. Very insightful presentation. My name is Yoba Saidu. I work for the Clinton Health Access Initiative. I actually feel their pains when it comes to like communicating their work in English, and it's really a glaring example of inequity in research. And we do not only see that in research, but we also see that in public health, where applications are sent to Global Fund, and also organizations like Gavi do not get the sufficient attention that they need to get because they are written in languages other than English. So there is like a very, very big problem. So I just want to like highlight that on Friday morning, we are going to have like a session with the Bill and Melinda Gates Foundation, just to present a new initiative that we kind of conceived to actually kind of break the vicious cycle in research. So what we tend to see is that for research funding goes to particular institutions in Africa, and they build capacity, they develop, they generate more research output, they build the experience and the track record, and they keep on attracting the funding. But on the other side, we don't see that sort of thing. So that sort of vicious cycle, I think, is something that we really need to like work collaboratively and collectively to break. And I think the session that we're gonna organize on Friday morning at 8 a.m. can really be like a very nice session for some of you. Thank you.
Thank you very much. And then the last comment, Celso.
Thank you. So my name is Celso Cosa from Mozambique, National Institute of Health. So maybe just a comment, at least that's my feeling, that in the PALOPs we work in silos, and it's very difficult to find, investigators from other countries that want to apply to grants together. We had that experience in the last Gulbenkian, because we tried to have a consortium of all Portuguese-speaking countries, and I only got answers from Angola and from Cape Verde. And I didn't get, although I have sent emails to several investigators from those countries. So maybe we need a platform to know each other, that we can easily find other investigators that are working on the same area.
Yeah. So, last one. That has to be the last one. So.
I think it's the last one, right?
Okay.
So my name is Fabiana Alves. I am Brazilian. I work at this organization called DNDI, Drugs for Neglected Diseases Initiative. And I would be very much interested to know about opportunities to collaborate, not in malaria, in TB, but in other NTDs. We need to, really increase the awareness and the advocacy for the NTDs and also improve the treatments for patients suffering from NTDs. So we would be very happy to exchange with you and also think about maybe South-South collaboration with partners in Brazil as well. Okay, thank you.
Fantastic. So, thank you very much for your time. This has been wonderful, but always when we discuss these language proximities, not intentionally, I used to think that we end up having boxes based on language in science, or should we bring all the players in one table and give them opportunity to learn and get those skills in communication and to allow them to play in the same level, maintaining the level of quality of science, not having a secondary level of science because of the language. So this is very important. Many suggestions came out, so platforms for communication, exchanging exercise between institutions, being exposed and selling yourself as an institution to science environment. So I think those are very important aspects, but also investing in human capacity. I was so glad when my colleague saying that I'm sitting close to the financial chief here. So I think he's getting our message. He's not the only one who decides, but we have to also promote that investment in communication skills. They're very important. So I don't want to make my speech long. I want to invite Infanta Cristina to give us final words. Thank you very much.
Well, I think there's not much more to say. I just want to thank you all for being with us, for bearing with us at this time of the day after such an intense day. And thank you in the name of the Fundação Calouste Gulbenkian. So Sandra and Maria Herminia, please come. Marta from Caixa Foundation, and please Nelsa, Neidi, Claudia, Bartolomé for a photo. Thank you very much, all of you, and have a good evening. And we go home with lots of to-dos.